The biggest misconception about prehab for knee stiffness is that it has to be aggressive to be effective. For most people, it's the opposite. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. If you're listening to this episode because you have a knee replacement coming up, you're in the right place. In episode 78, we wrapped up our sleep series, and now we're shifting toward what can be helpful before surgery. This is the first episode in a series of 4 episodes about prehab, what to do before you have surgery. And we're starting with a situation I hear about frequently, and that is knee stiffness. By the end of this episode, you'll have a clearer understanding of what knee stiffness before surgery usually comes from, why it shows up the way it does, and what kinds of prehab choices tend to make your knee easier to work with after surgery. When people say their knee is stiff before surgery, they can mean a few different things. Sometimes it's a true range of motion problem. You cannot fully straighten your knee, or you cannot fully bend it the way you used to. Sometimes it's a swelling problem. Your knee feels tight and full by the end of the day, and your knee stiffness is worse the next morning. Sometimes it's a guarding problem. Your knee has learned to protect itself, so motion feels restricted, even when there's more motion actually available than it's giving you in that moment. Most of the time, it's a mix. Prehab for knee stiffness is not just about increasing flexibility. It's about making motion feel easier, reducing the amount of tightness that builds across the day, and preparing your body for the first weeks after surgery when motion work becomes part of the daily routine. Let me give you an example using someone we'll call Megan. She isn't a real person, but she reflects what a lot of people describe before knee replacement surgery. Megan has a surgery date on the calendar. Her knee does not straighten all the way, and that shows up in her walking. She limps, her gait looks uneven, and the longer she's on her feet, the more that bend takes over. She also notices her knee feels tighter at night. In the morning, her knee can feel stiff enough that it's hard to get going until things loosen up. She has to walk around for a little bit and let it ease before she can really start her day. She's not alone. One reason this is worth addressing before surgery is that preoperative motion is linked to postoperative motion. It's not a simple one-to-one guarantee, but multiple studies have shown that range and function before surgery can help predict what range and function look like later on. A recent study in an enhanced care pathway setting found that preoperative range of motion measures were associated with postoperative motion outcomes, which reinforces a point most experienced therapists already know. If your knee goes into surgery with a meaningful loss of extension or flexion, it's usually harder work to regain that motion afterward. That doesn't mean you need to obsess over your numbers. It means use the time you have. The biggest misconception about prehab for knee stiffness is that it has to be aggressive to be effective. For most people, it's the opposite. The most helpful approach is usually consistent, repeated motion that stays inside a tolerable range and shows up in your day often enough that your knee stops treating movement like a threat. This is also where swelling control becomes a part of knee stiffness work. Swelling can limit motion because extra fluid and tissue pressure inside and around your knee can make the knee joint capsule feel tighter and more sensitive. And it can also make it harder for your kneecap to glide the way it needs to during bending and straightening. If your knee swells and tightens by late afternoon, your best motion work is often earlier in the day before the tightness has built up. That timing principle becomes even more important after surgery, so prehab is a good time to practice it. This is also where the research lines up with what clinicians see every day. Prehab before knee replacement can help with function going into surgery and in the first few months after, which is when knee stiffness work, swelling patterns, and motion practice are front and center. A JOSPT review, which is the Journal of Orthopedic and Sports Physical Therapy, this review supports that early benefit window, and that's why prehab isn't wasted effort. It doesn't guarantee a perfect course, but it can make your knee easier to work with when it counts most. In other words, prehab tends to pay off most in the early stretch, and knee stiffness is one of the places you can feel that. So let's talk about what prehab for knee stiffness looks like when it's done well. First, it respects extension. People tend to focus on bending, but being able to straighten your knee is the foundation for walking, standing, and stairs. If you've been living with a flexed knee posture, your calf, hamstrings, and tissues behind the knee can become less tolerant of stretch. Prehab is not about yanking on those tissues. It's about spending short, repeated periods letting your knee hang closer to straight, letting your heel be supported, and letting your body adapt to that position over time. Second, it uses flexion in a way that's realistic. Flexion work is not only for the number on a goniometer. It's for getting up from a chair, getting in and out of a car, and going up and down stairs. If your knee feels blocked in bending, the question is often whether the block is pain, swelling pressure, or a true tissue restriction. The answer changes what helps. Third, it builds motion into the day instead of making it a single event. This is one of the daily habits that moves the needle. A few short motion doses tend to work better than one long, intense session that leaves your knee irritated for the rest of the day. Megan learned this the hard way. Her first instinct was to do one big stretch session at night. She would push her bend when the knee was already tight. She would feel accomplished, but then she would wake up the next morning with a knee that was stiffer than the day before. Once she shifted to shorter motion work earlier, her knee started behaving differently. Not perfect, but more workable. That's the practical part of prehab, and it's also the part that makes sense once you understand what knee stiffness usually is. The other big piece is strength, because knee stiffness and weakness often travel together. When your quads are weak, your knee has less support in walking, and your brain tends to guard. Guarding is a protective pattern. It can show up as knee stiffness, not because your knee suddenly lost motion, but because your body is reluctant to use what's available. It often looks like a shorter stride, a bent knee walking pattern, and a knee that feels stiff because it isn't moving through its usual range. And when you try to work on that range, that same protection can make the stretch feel sharper and harder to tolerate, because your body braces the moment you start to push into end range. The key is matching the dose so that you get the benefit without lighting your knee up. We'll talk a little bit more about strength in the next episode. Every prehab plan should be individualized, but it helps not to make it only stretching. Motion work gets you closer to the range you need, and strength work will help you control it. If you have a longer runway before surgery, you can build meaningful improvements in motion and strength. If you're close to surgery, you may not be seeing big strength changes, but practicing the basics of motion still sets you up for the early weeks when your therapist asks you to work on motion and walking again. Swelling is often one of the biggest drivers of knee stiffness before surgery, and if your knee swells most days, you already know how much it can run the day. Swelling changes how your knee moves, and it changes how you move. Prehab is a good time to get more intentional about activity titration, which is how you spread activity across the day, and how you build it in short recovery windows so swelling does not keep climbing into the evening. Elevation can be a part of that plan, especially when it's used earlier. Cold packs can work alongside elevation for most people. Some people also use compression as part of their swelling plan. If swelling is a major driver for you, bring that up with your provider so you can make a plan that fits your needs. If you want to know whether your knee stiffness is primarily swelling-driven, look at the timeline. If mornings are better and evenings are worse, swelling is often part of the story. If your knee is stiff at the same level all day, you may be dealing with a more fixed restriction. Either way, motion is still useful. The difference is how you dose it. I also want to make sure we don't turn prehab into a blame story. Some people hear prehab discussions and feel like the message is, if you don't do prehab, you caused your hard weeks after surgery. And that's really not true. Surgery is still surgery. Your knee is still going to swell after surgery. Your sleep can still be interrupted, and you can still have a bumpy week, or actually about 2 weeks. Prehab is not about earning an easy experience right after surgery. It's about stacking the odds toward a more manageable one. If you're someone with a very stiff knee, you may be wondering if you can change your motion at all before surgery. Sometimes you can change it a little. Sometimes you change how it feels more than changing a number. Sometimes the biggest change is that your motion work becomes familiar, so after surgery, you don't feel lost when your therapist asks you to work on extension and bend. That familiarity is a real benefit for a lot of people. There's also broader research across orthopedic surgery showing that prehab can improve function and quality of life before surgery, and that can translate into an easier start afterward because you go in stronger, more conditioned, less deconditioned. And for someone planning knee replacement, the message is that prehab is not only about your knee, it's also about both your legs, your stamina, and your day-to-day capacity. So the early post-op phase feels more manageable. So if we bring this back to Megan, what did she actually do with this? She stopped trying to win a stretching contest at night and started building motion into her morning and midday instead, when her knee was more willing to move. She paid attention to how swelling behaved across her day, because that changed how her knee stiffness felt by evening. She also built enough strength work into her week that her knee stopped feeling like it was carrying her on its own, and that changed how she walked. We'll talk more about that in episode 80. Those changes did not erase her knee stiffness, but they made it more workable. That's what I'd love for you. The goal of prehab for knee stiffness is generally not a perfect knee before surgery. It's a knee that feels a little better before surgery and easier to work with immediately following surgery. One quick safety note: if you do have a sudden major swelling, redness, fever, or other symptoms that concern you before surgery, definitely contact your provider. Before we wrap up, if you're listening and thinking, yep, that's me, make sure you're signed up for the Total Knee Success Insider newsletter. You'll get practical education that matches your phase of healing and helps you know what to expect. Click on the link in the show notes or go to totalkneesuccess.com. And if you want extra support making sense of pain after surgery, my book, Making Sense of Pain After Knee Replacement, is on Amazon in paperback or Kindle. It's a focused, practical guide to interpreting swelling, knee stiffness, soreness, setbacks, movement discomfort, and day-to-day symptom changes after knee replacement. I'll link it in the show notes. In episode 80, we'll stay in prehab, but we'll shift the focus to weak quads, strength, and activation, and why that work tends to show up early after surgery. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.